We've covered the fitness component strength. So now let's discuss the remaining three components of health-related fitness: cardiovascular endurance, flexibility, and body composition. We'll also take a look at the first stages of program development. We begin with a look at cardiovascular training theory and the benefits of aerobic fitness training. Aerobics, whether it be aerobic endurance training or some form of cardiovascular work on a treadmill, stepper, or bike, has numerous benefits, from fat burning to cardiovascular health to improved recovery abilities. Aerobic fitness is defined as the capacity to take in, transport, and utilize oxygen, with oxygen being the key component. As we discussed in our metabolism lecture, aerobic means in the presence of oxygen, and anaerobic means in the absence of oxygen. Aerobic training involves exercising aerobically in order to improve your level of aerobic fitness. Over time, as you overload your oxygen transport and utilization systems, your body adapts to the demands that are placed upon it. Collectively, this process of overload and adaptation is called aerobic training. There are many benefits to aerobic training, and most physicians will state that it is the most important component of physical fitness. Benefits include, but are not limited to, increasing your level of available energy, relieving stress and anxiety, reducing the risk of heart disease, improving mental sharpness, and burning body fat. There are many terms that exercise scientists use to describe the different aspects of aerobic training. Knowing these terms will enable you to make more informed decisions about your client's training goals and regimen. Maximum oxygen uptake, or VO2 max, is the maximum amount of oxygen that can be transported to your body's tissues from the lungs. Maximal heart rate is estimated by subtracting your age from 220. Your maximal heart rate is used to calculate your aerobic training zone. Depending upon how physically fit you are, the lower and upper limits of your aerobic training zone are approximately 55% to 85% of your maximal heart rate. An MET is a unit of measurement that refers to the relative energy demands of an activity in comparison to your energy demands during a resting state. For example, if you exercise at a 6 MET level, you are exercising at a rate that is 6 times your resting state. A watt is a measure of power. It describes work performed per unit of time, using a known force, distance, and time frame. There are many different ways to exercise aerobically, from jogging to rowing to biking and beyond. What's important is to find an exercise that is enjoyable for your client, but also safe and effective. Cycling is an excellent form of aerobic exercise. It places a substantial demand on the heart and lungs and can burn up to 900 calories per hour. The rowing machine works the upper body, as well as the lower body, 65 to 75% lower body work, and 25 to 35% upper body work. Stair climbing is safe, time-efficient, functional, and the most popular method of gym aerobic work. If your client likes to walk, jog, or run, a treadmill provides a very safe method of cardiovascular exercise. Cross-training means using several modes of training to develop a specific component of fitness. Although performing one exercise, such as biking, will not make you more efficient at another exercise, such as running, there are advantages to cross-training. Cardiovascular exercise helps your cardiovascular system to become more efficient, regardless of the variety of exercises you may use. Using a variety of exercises also helps to decrease the amount of stress applied to the same bones and muscle groups over and over. This decreases the likelihood of developing an overuse injury. Another benefit of doing a variety of exercises is that it keeps workouts more interesting, fun, and motivating. We will now move on to the next component of health-related fitness: flexibility. Flexibility is the ability to flex, extend, or circumduct the joints through their full intended range of motion. Everyone, even the most sedentary, needs a certain level of flexibility and mobility. The question is, how much? Although the vast majority of people already have an adequate amount of flexibility, functional strength in the stretched position is often neglected. Strength and flexibility must be complementary. And so, a training program must focus on both concurrently. The anatomical and physiological basis of stretching revolves around the sarcomere, and the three primary inhibitory proprioceptors: the Golgi tendon organ, the muscle spindle, and the Pacinian corpuscles. The Golgi tendon organ is located at the musculotendinous junction, and it detects the magnitude of mechanical stress at this location. When excessive tension develops, the Golgi tendon organ causes the motor cortex of the brain to shut off muscle contraction. The muscle spindle is actually a specialized muscle fiber which detects excessive stretch within the muscle. Muscles responsible for fine movements contain more muscle spindles than muscles responsible for gross movements. The muscle spindle, unlike the Golgi tendon organ, does not relay inhibitory messages through the motor cortex of the nervous system. Instead, it acts locally as an inhibitory knob. Pacinian corpuscles are small, elliptical bodies which lie in the deep layers of the skin in close proximity to the Golgi tendon organs. They function as pressure receptors, but also have a role in proprioception. The way they control the contraction, however, is not well understood. As we discussed in muscular anatomy, muscle cells contain units called myofibrils that allow them to contract and stretch. The sarcomere is the basic unit of the muscle cell's myofibril, and there may be as many as 100,000 sarcomeres in a single muscle cell. Myofibrils have the ability to change length because of their overlapping strands of actin and myosin. During the stretch, the fibers elongate as each sarcomere extends to the point where no overlap between the thick and thin filaments exists at all. Because flexibility can play a role in general fitness and sports performance, it is a good idea for trainers to be able to adequately assess flexibility in clients. Specific joint range of motion is measured with a goniometer, a specialized protractor with two arms which rotate about one another. Since a goniometer is normally reserved for therapeutic applications, several standardized tests can be used: sit and reach, hip flexor, shoulder flexibility, and trunk extension. As with all other motor abilities, the potential to increase joint flexibility to an extreme degree is, to a certain extent, genetically predetermined. The structure and shape of the joint will ultimately determine the farthest a muscle can be stretched. Healthy muscle tissue can be stretched to about twice its resting length. Chronically shortened muscles can be the first step in a series of events leading to injury. Chronic shortening can occur from repetitive activities that have a limited range of motion, such as cycling. Over time, chronically shortened muscles can cause imbalances in the body, resulting in pain, injury, and disability. Flexibility is specific to three criteria: joint specificity, position and speed specificity, and training specificity. Joint specificity simply states that increasing the flexibility of one joint will not affect another joint. So, for example, increasing hip flexibility will not have an effect on shoulder flexibility. Your joint position and speed of movement when trying to increase flexibility should closely mimic the activity that requires the flexibility. For example, dynamic stretching movements, such as a high kick, will not enhance your ability to perform a static skill, such as a split on the floor. Training specificity refers to resistance training. When resistance training works a joint through its full range of motion, as well as equally working antagonist muscle pairs, it contributes to increased joint flexibility. There are several factors to consider with stretching that can have an immediate or long-term effect on your results. Temperature is a very important consideration when attempting to improve joint flexibility. Increased temperature helps to facilitate increases in range of motion, while decreased temperature tends to preserve decreases in muscle length. Tension magnitude, or how aggressively one stretches, is specific to one's goals. Stretch to the point of mild to moderate discomfort if the goal is to improve range of motion, but short of discomfort if the primary objective is to speed up the removal of waste products during or after a workout. Correct breathing should enhance relaxation while stretching, particularly when exhalation is timed to coincide with the elongation phase of the stretch. Stretching exercises should be periodized throughout the training cycle to enhance fitness goals. Proper timing and attention to range of motion can make a big difference in the success of your program. The most common methods of increasing joint flexibility are static stretching, dynamic stretching, PNF method, contract relax CR method, contract antagonist relax CA method, fascial stretching, and foam rolling. There are two types of static stretching, active and passive. In static active stretching, you move slowly toward your extreme range of motion for the joint you are stretching. Upon reaching the desired level of tension, hold for 20 to 60 seconds. In static passive stretching, you have a partner move toward your maximum range of motion, ROM, as you relax during the stretch. Dynamic stretching involves swinging the arm or leg in a controlled manner. The PNF method refers to proprio-neuromuscular facilitation, and it is performed by a registered physical therapist. However, there are two methods that we can use as trainers that are not true PNF, but they operate on similar principles. These are the contract-relax method and the contract-antagonist-relax method. The contract-relax method, or CR, is performed with a partner who carefully provides resistance for the muscle being stretched prior to actually stretching it. By contracting the muscle prior to being stretched, you effectively inhibit the stretch reflex, which enables you to stretch the muscle further. Contract antagonist relax stretching, or CA, takes advantage of a phenomenon known as reciprocal innervation. Antagonist muscle groups must relax and lengthen when the agonist group contracts. By isometrically contracting the antagonist immediately prior to stretching the agonist group, reciprocal innervation will help facilitate an increase in the agonist muscle. Fascial stretching involves deep tissue manipulation and is thought to unbind muscle fascia that may be restricting movement. Fascial stretching should only be performed by a competent physical therapist. Self-myofascial release, better known as foam rolling, is a soft tissue therapy for the treatment of skeletal muscle immobility and pain. Foam rolling is primarily performed post-workout and during off-training days. You may spend approximately 1 to 2 minutes per foam rolling technique per spot, and 30 to 45 seconds on a painful, tender area. As personal trainers, we have a tremendous influence on shaping the health attitudes and practices of those around us. With the growing rates of obesity, our efficacy in this regard is extremely important. Body composition assessment, or the determination of the fat and lean compartments of the human body through various methods, is a powerful tool for the personal trainer. This assessment is necessary for setting individual nutrition guidelines, as well as tracking client progress. Body composition testing is a part of the initial assessment procedure with new clients, and an important ongoing evaluative test with existing clients. The somatotype system classifies the human body into 3 types: mesomorphic, ectomorphic, and endomorphic. Mesomorphs are classified as muscular body types. Ectomorphs are classified as slim or linear body types. Endomorphs are classified as round types. While somatotypes are useful to classify a client's starting body type, they are not the end-all. Genetic background neither dooms nor guarantees success in achieving total fitness. Many clients will shift between body types throughout their lifetime, depending on life cycle. Also, many clients have characteristics of more than one body type. There are 2 methods of body composition analysis that are often used to predict future disease risk or current health. The Body Mass Index, BMI, is a measure that describes relative weight for height. BMI is often used as a predictor of future disease risk. Evaluating fat in the abdominal region through waist circumference measurements. Evaluating fat in the abdominal region through waist circumference measurements is important in determining an individual's health risk. The fat in the abdominal region, known as visceral fat, is associated with higher risks of diseases such as type 2 diabetes and cardiovascular disease. The cutoffs for increased health risk are 40 inches for men and 35 inches for women. When determining body composition, it is important to know the components of the human body and what we are measuring. The body's 3 main structural components include muscle, fat, and bone. Total body fat is deposited in different sections of the body and consists of essential fat and storage fat. Essential fat refers to fat stored in the marrow of bones, the heart, lungs, liver, spleen, kidneys, intestines, muscles, and lipid-rich tissues throughout the central nervous system. Storage fat consists of fat that accumulates in adipose tissue. Most experts in the field of body composition research agree that the average body fat for young men is 15% of body weight and 25% of body weight for women. Scales, BMI, and waist measurements do not account for the proportion of fat to lean tissue. The real health concern is the portion of fat as compared to overall weight. The fat and lean compartments of the human body can be determined through numerous methods including DEXA, underwater weighing, potassium ion, BIA, NMR, ultrasound, NIR, and skin fold thickness. Skin fold thickness measuring is inexpensive and portable, making this a valuable tool for the personal trainer. The 8 most frequently measured skin fold sites are the triceps, subscapular, pectoral, mid-axillary, abdominal, suprailiac, quadriceps, and calf. Skin fold scores are entered into mathematical equations designed to predict body intensity and percent body fat. There are 3 methods to apply body composition statistics to fitness goals, including calculating body fat in pounds, calculating lean body mass, and calculating your client's goal weight. You can use the information obtained through body composition analysis to help you design an appropriate time frame for expected results. A few steps can take you from body fat percentage to the number of weeks required to reach a specific goal. Now that we have the components of fitness under our belts, let's take a look at how we can put this knowledge into practice. Your client's definition of fitness may or may not be broken down into the academic components we've been discussing. What will be important is for you to help your clients communicate what they want out of working with you, and use assessment, training principles, and periodization to help them reach their goals. The first step in getting a client started is the drawing in phase. The drawing in phase ensures a high level of client motivation, distinguishes you as a professional, and consists of the following 5 steps. 1. Establishing yourself as a professional. 2. Data collection. 3. Guided discovery. 4. Feeling the water before jumping in. And 5. Establishing an integrated training process. The best way to establish yourself as a professional is through client rapport, knowing your craft, sincerity, integrity, enthusiasm, and proper business ethics. These elements build trust between you and your client and serve as the foundation for your professional relationship. The next step is data collection. This process is an ongoing one and includes learning your client's health history, fitness patterns, lifestyle habits, and collecting release of liability forms and physician consent if needed. Guided discovery is the process of orienting your clients to your fitness facility and/or equipment. This phase can last 2 to 3 weeks, or as little as a few workouts. Guided discovery allows you to orient your clients to available technologies. It also helps you get a sense of your client's familiarity with the tools of training and a sense of what they like and don't like, all helpful when you go to design a program. Once you have designed a program for a new client, you'll want to feel the water before jumping in, which simply means have your client try it out, but know you'll need to make adjustments. Programs won't be perfect right off the bat, and you'll need to observe the client's compliance, ability, and discipline to continue. If they don't like an exercise, or if a particular eating schedule doesn't fit their life, they won't stick with it. Observe how the client responds and make adjustments accordingly. With the right adjustments, the client can turn your program into a lifestyle. The last stage is the time for the client to identify the answer to these questions. What are my goals? What do I want to accomplish? What are my options? Before this time, neither you nor your client had the foggiest idea as to what your client's options were. Once you establish a relationship, collect data, complete a guided discovery, and assess your client's compliance, you can use information to establish a basic fitness program for an integrated fitness lifestyle. Goal orientation is a key element in establishing strong motivation. Helping your clients achieve their goals will be easier if their goals are specific and well-defined. Putting goals in writing and keeping them where they will be seen often will help the client to focus on what they are working towards. Goals should be stated in the positive and have a deadline for completion. Goals should also have sincere emotional appeal and be difficult but realistic. Motivation is a need that incites action. You'll need to develop a sense of what incites your clients to learn, what gets them to exercise, and what motivates them to continue. Recognition and praise can be strong motivators, as can listening and effective communication. What the client hears is more important than what the trainer says. Communication occurs through the visual, auditory, and kinesthetic tactile domains. A lot of clients learn by watching. Whenever possible, trainers should demonstrate skills and tell their clients what to look for in the movement. Visual cues such as arrows, lines, or stickers applied to the floor or equipment can assist clients with body awareness. The auditory domain, or hearing domain, is important to communication between you and your client. Asking questions about discomfort, asking for feedback, and giving praise will fall into this domain. Verbal cues and reminders can also be very helpful to help your clients execute exercises properly. In the kinesthetic or tactile domain, you can manually guide a participant through a desired motion. You can also manually assist a client in achieving a full range of motion and correct form. Cardiovascular and flexibility training, as well as body composition assessment, are very important in improving the fitness level and well-being of your clients. Through proper drawing in and program development, you can help your clients incorporate vital elements of fitness into a lifestyle.